Welcome to the Introduction to Diabetes module, which is the first module in the comprehensive exploration of diabetes elective at UNC School of Medicine. My name is Cy Fogelman, and I'm a member of the class of 2024. Myself and Dr. Young of the Endocrinology Department are creating this elective in hopes of helping students better understand diabetes. We are thankful that you are taking this elective, and we hope that this elective provides you with useful information to help you care for patients with diabetes. This lecture will focus on a few topics. The first is a basic explanation of what diabetes is. Then we'll talk about why every provider should care about diabetes regardless of their specialty. Then we'll discuss diabetes in the United States and in North Carolina. Diabetes mellitus was first noted in ancient Egypt during the BC time period. Individuals with diabetes were noted to have sweet-tasting urine and produce more urine, which led to the titles diabetes mellitus. Diabetes meaning a large amount of urine, while mellitus meaning sweet. If you had to define diabetes in one word, that word would be hyperglycemia. It is a very complex illness that is impacted by many factors and results in many complications. There are multiple types of diabetes, but the two main types are type 1 and type 2. Type 1 is 5 to 10% of cases and is defined by autoimmune destruction of pancreatic beta cells, which results in decreased insulin secretion. When you have decreased insulin secretion, that leads to an increased blood glucose. Type 2 diabetes is multifactorial, including diet, exercise, body weight, genetics, and other factors that lead to cells in the body not responding to insulin and ultimately leading to pancreatic beta cell dysfunction and death. This impacts insulin secretion and response to insulin, which leads to hyperglycemia as well. So why should all providers care about diabetes? Diabetes has many complications that impacts many different organs. Diabetes can damage your kidneys, heart, liver, nerves, eyes, vessels, and other structures throughout your body. Among patients with diabetes, 69% have hypertension, 44% have hyperlipidemia, 39% have CKD or chronic kidney disease, and 12% have vision issues including blindness and loss of vision. The recognition, diagnosis, and well-rounded multidisciplinary treatment teams and plans are key to improving quality of life and minimizing complications. These complications should concern all providers involved in patient care, and proper treatment or referral to treatment is paramount to decrease complications. Diabetes is considered a chronic condition, so it is sometimes easy to overlook and consider it an issue that a PCP or endocrinologist should worry about. However, diabetes can impact any population and is relevant to all specialties, especially given the increase in prevalence of diabetes in North Carolina and the United States and among younger age groups. So continuing on the topic of why all providers should care about diabetes, I will now talk about how different specialties can come into contact and care for patients with diabetes. In terms of primary care, such as family medicine, internal medicine, and pediatrics, along with endocrinologists, these providers will be very involved in the recognition, workup, diagnosis, and treatment of type 1 diabetes, prediabetes, and type 2 diabetes. For OBGYN, they will be managing gestational diabetes and will also be caring for patients who have diabetes prior to becoming pregnant and will need continued management and monitoring throughout their pregnancy. Surgeons will have to ensure that glucose is managed both pre- and post-operatively to avoid poor and adverse outcomes. Psychiatry is a very interesting specialty and actually intersects with diabetes a lot. Managing diabetes is very complex in some cases, which can be hard when someone is battling a mental illness at the same time they are trying to manage their diabetes. Interestingly, schizophrenia is considered a risk factor for the development of type 2 diabetes, which shows how pre-existing mental illness can impact the development of diabetes. The presence of diabetes can also result in a lot of psychological distress and development of mental illness. This includes depression and anxiety. Developing a new mental illness is likely due to the fact that type 2 diabetes is a chronic condition and comes with multiple life-changing complications such as amputations and blindness, just to name a few of the more severe complications. There are also a lot of demands that accompany diabetes, which can lead to developing mental illness like constant appointments, constant monitoring of blood sugars, and constant medication ingestion or injection. In terms of specialists, they may be serving a patient with diabetes for another issue or as a result of one of the complications that can result from diabetes. This includes nephrology, hepatology, ophthalmology, wound care, and podiatry. Diabetes can also impact medication regimens, which other specialists will need to be aware of so that they can prescribe the correct medications. And diabetes can also impact finances because the medications can be expensive and you can be on multiple medications, which is very important because other specialists and providers will need to help ensure that the patient can afford medications that they're prescribing and also afford supplies. As you can see, diabetes is pertinent to all providers and specialties, so it is very important for medical students, residents, and providers to take the time to understand diabetes so that they can effectively serve the patients they are helping who also have diabetes. Now we will talk about diabetes in the United States. The statistics on diabetes in the U.S. are very concerning. About 11% or 37.3 million people have diabetes, and 1 in 5 of those with diabetes are not aware that they have it. This is very concerning because people who are not aware that they have diabetes will not receive the treatment they need to prevent the complications that can develop from diabetes. 96 million people have prediabetes, which is about 1 in 3 people in the United States. Of those people with prediabetes, 8 out of 10 are not aware that they have this, because prediabetes is silent and can be found only through labs, which the person may not be getting for various reasons. The people with prediabetes are at very high risk of developing diabetes. All of these statistics are very concerning, and if we stay at the current rate and current trend, 1 in 3 people in the United States will have diabetes in 2050. Sadly, there has also been an increase in type 2 diabetes diagnosis in the 10 to 19-year-old age range demographic, which is concerning because diabetes has historically impacted middle and older aged adults. Diabetes is the 8th leading cause of death, which is likely false since, as we see above, many cases are undiagnosed. Diabetes has also been shown to disproportionately impact Black and Hispanic populations, which is unacceptable. Given UNC School of Medicine's mission to train providers to meet our state's needs and serve the citizens of our state, it is important to understand how diabetes impacts those in North Carolina. In short, diabetes is an epidemic in North Carolina. Around 12.4% or 1 million people have diabetes. This is a 33% increase from 2008, when the percentage of North Carolinians who had diabetes was 9.3. There are also 244,000 undiagnosed cases of diabetes in North Carolina. 34.6% or 2.7 million have prediabetes. So if you combine the 34.6% who have prediabetes and the 12.4% who have diabetes, you get 47%. This means that 47% of North Carolinians either have diabetes or are at high risk of developing diabetes. Again, this is likely falsely low given the underdiagnosis of diabetes and prediabetes. North Carolina is 7th in the nation for diabetes-related deaths. Another way to say that is that we have the 7th highest death rate related to diabetes. The disproportionate impact of certain demographics is also true in North Carolina. Approximately 19% of American Indians had diabetes in 2012 and is the 3rd leading cause of death in this population. About 16% of African Americans had diabetes in 2018, and diabetes is the 4th leading cause of death in this population. Sadly, 25% of African Americans in the 55 to 64 age range and 33% in the 65 to 74 age range have diabetes. Diabetes also creates financial strain for North Carolina residents who have diabetes because the medical cost for those with diabetes is about 2.3 times higher than those without diabetes. For all of these reasons and many more, North Carolina is in great need of providers who are willing to provide well-rounded and patient-centered care when it comes to diabetes. Having been born and raised in North Carolina, I have always found that the geography of the state has been very intriguing. From the mountains in the west to the coast in the east, we have an incredibly beautiful state. However, geography seems to play a role in not just the terrain, but in many things, including healthcare resources. The Piedmont, which is French for foothills, is the central portion of the state, which is a more populated area and contains more resources, especially healthcare. In the Piedmont, the rate of diabetes is 11.4%. The eastern and western portions of the state are much more rural. There are less resources in these regions, which is evident in the statistics. 14.4% of eastern North Carolinians have diabetes, while 13% in the western region of the state have diabetes. This raises multiple issues and brings to the forefront many questions about why there are differences in different areas of the state. A couple of the issues are access to care, number of providers, allocation of resources, just to name a few. This also highlights the importance of rural health providers. North Carolina is lacking rural providers in many areas across our state. More providers are needed in order to increase access to care so that we can facilitate diagnosis and provide the much needed multidisciplinary treatment teams to help those with diabetes and other chronic conditions. In rural North Carolina, just to highlight a few shorter statistics, there are 1.68 family medicine doctors per 10,000 people in western Cherokee County. In eastern Bladen County, there are only 1.75 doctors per 10,000 people. For those requiring more advanced diabetes care, or for those who wish to see an endocrinologist for their diabetes care, 59 out of our 100 counties do not have an endocrinologist. As you can see on this map provided by the Shep Center, this means that some people have to travel hours for endocrinology care. As you can see in the mountains and in the western or left part of the state, and in the eastern part of the state, the top right and the bottom right, you see huge swaths of gray, which is 0 providers in those counties, which is very concerning because some of those counties are very large and could take hours to get to an endocrinologist, depending on where the endocrinologist is located in the counties where there are one. So this is very concerning, and this means that many people may go without diagnosis or care, which is evident in the number of people in North Carolina who have diabetes, and especially in those who are undiagnosed. To conclude this introductory module, I would like to thank you again for taking this elective. As you can see, the statistics in the United States and North Carolina are staggering and are only forecasted to get worse unless we do something to reverse the course. Please take this elective as an opportunity to learn as much as possible about diabetes and ask as many questions as possible when you are with the fellows and with the attendings on the various services and clinics that you will be in, so that you can provide the best care possible to those with diabetes that you care for in the future.